All right, let's boot up what is, without a doubt, the most complex operating system on the entire planet, the human mind. And in this explainer, we're going to crack open the code of psychiatry and look at it in a way you might not have before.
So let's start with a really simple but kind of profound question. What if your brain was a computer? I mean, think about it. It's this incredibly advanced biological machine, right? It's got its own hardware, a totally unique operating system, and yeah, as we're about to find out, its very own set of bugs.
So, using that computer analogy as our guide, we're going to break down the basics of psychiatry. We're going to start with the hardware, the physical stuff. Then we'll look at the software that runs on it. And finally, we'll dive into what happens when the whole system glitches. And maybe, just maybe, how we can debug the human mind.
Okay, part one, the hardware. Every single computer needs a core processor, right? A CPU. Well, in our brain, the central processing unit for everything to do with emotion and memory, that's called the limbic system.
So what does this limbic system actually do? Well, you can think of it as this absolutely crucial bridge. It connects all our deep, unconscious drives, the stuff we're not even aware of, with our conscious, everyday thoughts. It's the central hub that's processing memories and basically running the show when it comes to our mood, our motivation, the whole shebang.
So let's break that down and look at the actual components. First up, you've got the thalamus. Just think of this as the main server, or maybe the data router for your brain. Seriously, all the sensory info coming into your system, everything you see, hear, taste, touch, and smell, it all has to pass through the thalamus first. And its job is to direct all that traffic to the right place for processing.
Okay, now right underneath the thalamus, you have the hypothalamus. If the thalamus is the router, this is the system's main control panel. We're talking about our most basic primal drives here. It's regulating fundamental things like pleasure, excitement, fear, anger, but it also controls the really essential stuff, like hunger and sex drive.
So every computer needs a place to store its files, right? Well, in our brain, that's the hippocampus. This is literally the hard drive for our long-term memories. And it's not just passively storing data. It's constantly, actively helping us compare what's happening right now to our past experiences. That's what gives us context for our emotions and our actions.
And of course, any good computer needs some top-notch security software. In our brain, that's the job of the amygdaloid bodies. You can think of them as this always-on threat detection system. They are constantly scanning for danger, interpreting really subtle social cues like facial expressions, and then triggering emotions like fear to keep us safe.
All right, so that's the hardware in a nutshell. But what about the software that's actually running on it? Well, that brings us to part two, the chemical code that really dictates our emotions and our behavior.
This code is written with special chemicals called neurotransmitters. These are basically the chemical messengers that let our brain cells talk to each other. So you can really think of them as the programming language for our mind. And just like with real code, when the levels are all balanced, the system runs great. But when they get out of whack, well, that's when our mental programs can get pretty buggy.
Let's take dopamine, for example. This is pretty much the brain's reward and motivation code. A little boost of it can create those intense feelings of infatuation, like when you first have a crush on someone. But if the levels get way too high, it's been linked to conditions like schizophrenia. And on the flip side, when those levels drop too low, it can lead straight to depression. So you see, it really is all about balance.
And it's not just dopamine. Two other really critical lines of code are serotonin and norepinephrine. A drop in serotonin, that's a classic signpost for depression. Now norepinephrine, it's a little more complex. Too much of it can trigger aggression or mania, but, and this is key, just like the others, too little of it can also lead to depression.
And then you've got these really specific subroutines, kind of like a special program that only runs when needed. A perfect example is the fight or flight program, and that's run by epinephrine. When you're actually faced with stress or danger, a huge surge of it prepares your body for action. The problem is, when this program starts running too often, or when there's no real threat, that's when it can show up as anxiety, phobias, or even full-blown panic attacks.
So all of this kind of leads us to part three. What happens when the system glitches? And this is a really, really important point. It's so helpful to think of psychiatric disorders not as some kind of personal failing, but as what they are, predictable glitches or bugs in an unbelievably complex biological system.
A phobia is a perfect example of one of these glitches. Honestly, the best way to think about it is like a recurring pop-up error message that you just can't close. A specific trigger, heights for acrophobia or crowds for agoraphobia, causes the system to run this intense and usually way over the top fear response.
The real glitch is that faulty connection the brain has made between the trigger and the actual level of danger.
Now, some glitches aren't just simple errors. Sometimes they represent a fundamentally different operating system altogether. Autism spectrum disorder is a great example. It's not a single bug, but a whole range of neurodevelopmental variations. And just like, say, Windows and macOS need different kinds of tech support, this spectrum just shows how individuals with ASD might need different levels of support to thrive.
And it's also really important to know that not all glitches look the same, which can be confusing. Take the common mix-up between OCD and OCPD. The way to think about it is this. OCD is like a software bug that's gotten stuck in an infinite loop. These uncontrollable thoughts, the obsessions, force repetitive actions, the compulsions. OCPD, on the other hand, isn't really a bug in the same way. It's more like a rigid system preference that's set to perfectionism and absolute control. See? They're totally different kinds of system errors.
Okay, so if our minds can have all these different kinds of glitches, how in the world do we find them? Well, that brings us to part 4, running the diagnostics. Let's take a look at how professionals actually pinpoint the source of these system errors.
And professionals have a whole diagnostic toolkit at their disposal. It usually starts with a psychiatric interview, which is kind of like talking to the user to figure out what's going wrong. Then they can run a full hardware check with CT and MRI scans to look at the brain's physical structure. PET scans can check the system's metabolism, how it's using energy. And things like personality questionnaires, they're like running special diagnostic software to find patterns in thought and behavior.
Some of these diagnostic tools are really interesting, designed to get access to the mind's hidden source code. Think about tests like the Rorschach inkblot test. A person is just asked to describe what they see in an abstract image. But, as this quote explains, while their attention is focused on describing the image, their interpretations can actually reveal these deep, underlying, unconscious thought patterns. It's like seeing the hidden code that's influencing all their conscious behavior.
So, once a bug has been identified, what's next? Well, it's time to try and fix it. And that brings us to our final section, the treatment toolkit, all the different therapies and procedures used to debug the mind.
And the repair manual is pretty extensive. You've got psychotherapy, or talk therapy, which you can think of as a guided debugging session for your thought patterns. Then there is cognitive behavioral therapy, or CBT, which is a bit more direct. It's about actively finding and rewriting faulty lines of code. Of course, there are medications, which act like chemical patches to correct those neurotransmitter imbalances we talked about. And for very severe treatment-resistant depression, there's even a procedure called electroconvulsive therapy, or ECT, which is kind of like a hard system reboot that can often provide incredibly rapid relief.
Okay, so let's do a super quick recap to bring it all home. We've got our hardware, the limbic system, our core processor. We've got our software, the neurotransmitters writing our emotional code. When there are glitches, we call them disorders. We can use diagnostics like tests and scans to find the source of the error. And finally, we have a whole toolkit of therapies and drugs to help debug and repair the system. Looking at the mind as an operating system is a really powerful way to understand mental health. It gives us more clarity and, hopefully, a lot less stigma. But it also leaves us with this one kind of huge, fascinating question. If our feelings, our thoughts, our behaviors are all rooted in this biological hardware and this chemical software, then how much of what makes you, you is already written in the code?